Hi everyone, my name is Dr. Melissa Estevillo. I'm a licensed clinical psychologist and owner of Biltmore Psychology and Counseling. So today we just wanted to answer some of the questions about this transition from in-person sessions to phone sessions. I'm going to try to rapid fire through a lot of these so that you guys get this information in a video that's not just too long. But if you have any more questions, you can always reach out and ask us those. So the very first question will be, will we keep our scheduled appointments? And so our plan is to have the exact same schedule that we've had before. And if you have a reoccurring appointment that's always been on the books, or if you've had 4 or 5 sessions that have been scheduled out, those are still on our books. That's still our plan to be able to see you. It's just not going to be in person. It's going to be a video and phone call session. And we'll talk about how long that will likely last for in a little bit. The second question that we have is, will we have the option to pick between phone and video call? And the answer to that is also yes. You know, there's some clients that I have that feel really comfortable using video call. They feel like it's the most similar to in-person sessions, and for a lot they say, you know, it's practically the same, or gosh, it's nice because I don't even have to drive there and have to factor that into the time. But there are some people where they just feel better on the phone and this is uncomfortable for them. And they feel intimidated by the technology, which we'll also talk about. You should not feel intimidated, it's easy. But again, if you just prefer the phone, then that's definitely an option for you. So will the video call be Hipaa compliant? So we have a couple different platforms that we're planning to use. One is called Doxy.me, and this is a telemedicine platform. The other one is one that's a Google product called Google Hangout Meet, and that's also Hipaa compliant. The reason that we have two is because we're a little bit nervous that, you know, with the kind of influx of people that are working from home, that some of these features or some of these platforms might crash. So we'll be able to let you know which platform we're likely going to be using, or we might just find in that moment if one isn't working, then we have another one, and know that the planner in me has backups to backups to backups. So we will have something available that's going to be a good resource to be able to conduct therapy. So another question is, what if I'm not tech savvy? So guys, these platforms are super easy, meaning like for Doxy.me, what we would do is just go and put your phone number in, send you a text. You would get that text just to be able to click on the box there. You put your name in saying, hey, I'm here for the appointment, and it puts you in queue. And when the therapist is ready, they click on you and the video pops up. So very, very simple, very easy. For Google Hangouts Meet, if you're on a desktop computer, we'll send you an email. You'll just be able to click on it, join the call. Again, very, very easy. So if you're not tech savvy, I promise you this isn't going to be overwhelming. And Veronica, our office coordinator, again, is here to help. So, do I have to use a computer for the video calls is another question. If you can, honestly, that would be the easiest. That would be the very most simple thing, is for you to be able to use a desktop computer, especially for using Google Hangouts Meet. But if that's not available, then we'll definitely walk you through some of the steps to be able to use your phone. It's, again, not super complicated. It's just like an extra step of needing to download the app for Google Hangouts Meet, or if we're using Doxy.me, then actually the phone is just as simple. So again, we'll let you know which platform ultimately we'll be using. How will I do couple sessions? So for a lot of people, they're worried, well, what if we're not in the same place, or what if one's still working from work and one is at home? So know that for any of the video calls, we can do a 3-way call, and if it's a phone call, again, the same. So for video, it's nice, you know, we'll be able to see 2 people together. But if there's a couple where they're both working from home, you know, then these are actually pretty wide-angled enough that 2 people are able to, you know, sit in the screen together. And I've had a lot of clients that have done that before in the past, and it works really nicely. Will therapy really work over the phone or video? So I think for a lot of clients, they're hesitant, feeling like, I don't think it's going to be exactly the same. There's nothing like being in person and being able to see my therapist there and kind of have that same in-person experience. And what I want you to know, as I would say prior to this all happening, maybe about a third of my clients had consistently or intermittently used phone or video call sessions for when they were traveling within the state, or they were, you know, slammed at work and weren't able to get there. And for a lot of them, they gave the feedback that it was super convenient, they liked it a lot, and that it was basically the same. Some even said, gosh, can I transition to this all the time, because it's so much more convenient than having to drive to your office. So we would not be offering this as a form of therapy if we didn't think that it would be excellent, and if we didn't think that this would be something that would provide amazing care. So we feel confident in that we'll be able to deliver the same quality care, just using all this technology as a way to be able to do the same thing. So another question, what if my kid walks in? So a lot of us have kids that are at home right now because school is not going to be in session probably for a little while. So big picture, if we do decide to do phone or video, we will let you know, our ethics require us to let you know that there is some limitations to confidentiality when you're not actually in a soundproofed office. So we want you to take extra precautions to make sure that you're in a quiet place, one that's secure, where you likely won't have people overhearing you or opening your door. If for some reason you feel like that's the case, your roommate walks in or your kid walks in the middle of the session, we want for you to stop talking, be able to let us know, and we know to stop. We won't say anything else until you feel like it's clear and safe to be able to proceed forward. Another thing like I have on right now is if it's an individual session, you can wear headphones, and so that'll control at least one way, with the noise coming through. So the very last question is, how long will this last? Guys, I wish I had the answer to that. I wish I knew how long it was going to last. I was thinking about how fast that this has transitioned from our Thursday staff meeting when we were sitting down talking about some of the possibilities to, making the decision on Sunday to roll to phone and video sessions. So I'd like to say that we're going to plan on this lasting through March 27th. But with everything changing so rapidly, I'm hesitant to say when exactly we think it will end. But we do want you to know we're committed to going back to in-person. We're committed to doing that as soon as it's safe, in terms of physical health for everyone. And we'll be the first to let you know when this transition to remote sessions or phone video sessions is over. Like I said, if you have any more questions, we definitely want to be able to field those for you. Our website is www.biltmorecounseling.com. Veronica is our office coordinator. She's going to be working from home, like I said. Her email is info@biltmorecounseling.com, and our phone number is 480-999-7070. So tune into our YouTube channel for more videos like this. We're also going to be posting some information on the blog, so we want to make sure that you guys are getting all the resources that you need. So until I get to see you in person or until I get to see you over a video or phone call, take care, be safe, and know that we're with you during this time.